be your second intercostal space. So this is where you're going to auscultate the aortic valve. That makes sense because you're just downstream from the aortic valve, which is going to be about right here. And so you're listening for changes in flow, because normal flow is going to be quiet, versus if you have stenosis or regurgitation of the aortic valve, you're going to hear that as a murmur at this site. At the second intercostal space, this is going to be the pulmonic valve. And so again, you're going to be just downstream from the pulmonic valve, where you can auscultate any abnormalities there. So if we come down here, and then we have the fifth intercostal space here. So if we go up right against the sternum here, the sternal border, in the left fifth intercostal space, we're listening for the tricuspid valve, because the tricuspid valve is going to be about right here. And so you're going to be downstream from there. And then here at the apex is where you're going to listen for the mitral valve.